So let us learn how to record ocular movements. Before we proceed, we must understand that the center of rotation for the eye lies along the listing's equatorial plane. Along the x-axis or the horizontal axis, the eyeball may move up and down, so elevation and depression. Along the y, the antero-posterior axis, there are rotational movements, and along the vertical or the z-axis, the eye may move inwards or outwards. In order to record the monoocular movements, first, monoocular movements that are called ductions, we ask the patient to close one eye. So, Ms. Choling, can you please close your one eye? Now, all I want you to do is, I have this target, you have to look at this target, and as I move, please follow with your eyes. I do not want you to move your head, keep your head fixed, just follow this red tip that you see. Is that okay? So now I'm checking the monoocular movements, also known as ductions. This is abduction, adduction, supraduction, and infraduction. We follow the same for the other eye. Can you now cover the other eye, please? Having recorded the monoocular movements, we now move on to check for binocular movements. Binocular movements are both the eyes moving together. Now these can be of two different types. One, where both the eyes are moving simultaneously and synchronously together in the same direction. Such movements are called versions. So Ms. Choling, can you please, with both your eyes, follow the tip, the red tip. Again, please do not move your head, just with your eyes. So this is the patient's right side. If she's looking towards her right, this is dextroversion. When she looks with both her eyes towards the left side, this is levoversion. Pure elevation or circumversion, and pure depression or deorcumversion. We have now checked in the 4 secondary directions of gaze. We now move on to record in the tertiary directions of gaze. While she is looking right and up, this is dextro elevation or dextro circumversion, dextro depression or dextro deorcumversion, levo elevation and levo depression. These were tertiary positions of gaze. When the patient is looking straight ahead, this is the primary position of gaze. Having checked for versions, we now move on to checking vergence, the binocular movements where both the eyes are moving simultaneously, synchronously together, but in opposite directions. Ms. Choling, I would want you to please look at this tip. I will be bringing it closer. You might feel some blurring of vision, but just keep your focus here. So this is convergence and divergence.